Have you guys recently had any conversations that was so ridiculous that it ends with a, how do you know? Do you have a PhD in coronavirus? Well, the next person that we're going to talk about, that's going to come on and talk, actually does have a PhD in coronavirus from Arizona State University. We've had multiple conversations with Dr. Bavi on different ways to get rid of COVID, from injecting bleach into your body, as suggested by a world leader, to an actual vaccine being available in the largest country in the world. Welcome, Bavi. What a time to be alive with a PhD in coronavirus. All yours.
Thank you, Vivek, for the introduction. So I'm going to go ahead and get started with a small presentation so we're all on the same page. All right. Okay. So my topic today is understanding coronavirus and the current vaccine scenario. We've talked to death about different aspects of the virus. So this is a brief understanding of the virus itself and where we stand in terms of the vaccines that are being touted as available, almost available, not available. The first few slides may be familiar to some of you. Now, we have what is called life, which is the kind of cycle that we all go through. And life is basically bacteria, which are single-celled organisms. Archaea, we don't really worry about it. And eukarya is anything from yeast that makes your beer to us human beings. If you notice, viruses don't come under this category. And viruses actually are a separate form of their own, meaning they only live inside cells, and outside the cells, they're considered inactivated or dead. And generally, all life, in the domains of life, have what is called DNA, which is what your architect will give you when you go ask them for, hey, this is the house that I want. Can you build something for me? The architect will build you a house with, or will show you a house with trees around it and a parking lot and everything. And there'll be clouds, who knows where, but it'll be there. But then that doesn't mean anything. So the architect will give some technical drawings like plumbing, electrical, structural drawings, out of which the contractor will build the house. So that's our DNA, RNA, and protein. Coronaviruses are very unique in the fact that they actually have no DNA. They only have RNA, and all this is used to make the proteins that make the virus itself. Now, coronaviruses are neither new nor novel. We have known about their existence from the 1950s, early 1960s, and they infect a range of hosts, humans, cattle, turkey, and in fact, any group of animals you see, you will find a coronavirus that infects it. And the way they infect it is not really always a respiratory infection. It can cause a liver or a gut damage. It can cause liver damage. It can cause neurological damage, or it can cause other problems like other immunological disorder, kidney function problems, etc. So people that have always been involved, the veterinarians are actually aware of coronaviruses and their impact on commercial animals. So when we've always known, hang on. Okay, so what is interesting is 30% of all common colds are caused by coronaviruses, meaning 1 in 3 common cold is caused by a coronavirus. So why all this hype? Now, different coronaviruses have come from different animals. It is people in the field are always have been aware that new infections come from wildlife to domesticated animals to humans. So we have had just coronavirus infections coming from bats through different animals like llamas, camels, civet cats to humans. And this SARS coronavirus 2, which causes COVID-19, came from bats, either directly or through an intermediate animal that we don't know yet. So it is not a biowar. Please don't type this question in the chat box. Now, this is on your left is what the virus looks like. And you see these big knobs on the outside. This is called the spike protein, which binds to the cell and initiates the infection. And this actually looks like crown, which in Latin is corona. That's what gives the virus its characteristic name. So on your right is what the virus actually looks like when you magnify it about 1 million, about 100,000 times. So you can actually see that it does look like the virus is wearing a crown on its head. Now, just like how we humans have a life cycle where we are born, we reach adolescence, we survive whatever it is life takes us through, we reproduce for the most part, some people don't, and then life comes to an end. The same way, a virus also has a life cycle, and this life cycle happens entirely inside a cell. So this virus is sort of floating around, and then when it finds a cell that it can infect, now not every virus can infect every cell, so it needs to find a suitable cell. It goes into the cell, and then it makes all the components that it needs, and then uses the cell to make multiple copies of itself, kind of like a Xerox machine, and then gets out. This is very interesting to know, because this is what we need to understand to know where we can target this virus life cycle to stop the infection. So when you have a vaccine, the vaccine will stop the virus infection at this point where it prevents the entry of the virus into the cell. No matter what the vaccine is, this is the step that they are targeting to prevent an infection. And then in case virus enters the cell, this particular step where the virus makes more copies of itself is stopped by using drugs like remdesivir and favipiravir. So when people ask questions, how do these drugs work? They typically stop these two steps because they are unique for the virus and not really, these steps don't exist in the human life cycle. Now the next question comes about, what about these vaccines? A typical vaccine development has all these stages, and this is how long it takes. So it takes about 30 plus 60, about 8 years or so for you to have a vaccine that is from the preclinical stage until it's available for vaccination to the public. However, COVID-19 vaccine development is going at breakneck speed, where we're looking to have a vaccine within the next year or so. And this is without compromising any of the safety factors that are involved. And as of August 20th, we have 165 vaccine candidates. And this is unheard of because everybody wants to test their model for the vaccine. And these are just relative numbers for other infectious diseases where vaccines have been developed or are being developed. So the race to get a successful vaccine is happening extremely fast, and we just have to wait for that time before the infection can be controlled. Now, these are the different vaccines that actually are in good, that make good technical sense and are in trial. The most promising one is called Covishield, which is manufactured by Oxford and AstraZeneca. As you see, we don't see our Russian vaccine anywhere here. So we'll talk more about that in the Q&A session. So our biggest hope actually lies with the Covishield, which has excellent information, which has excellent promise for giving us a protective vaccine in the near future. And what can you do until the vaccine comes? The basics remain the same. Wear your mask covering your nose and mouth. Do not go out. Wash your hands carefully and call your doctor before visiting. Thank you.
Thank you, Pavi. Entertaining and informative as always. Now we move on to the next person. This is Dr. Harini. Dr. Harini has completed her MBBS from Madras Medical College and MS OBG from SRM College, and subsequently she sorry, no,
MD Medicine.
I'm reading the wrong person. So okay, I think Dr. Harini actually worked as an assistant professor of medicine in Pondicherry Institute of Medical Science for 2 years. She is now an associate consultant, Department of General Medicine at Dr. Rela Institute of Medical Science in Chennai. She's also working with their COVID care team. Over to you, Dr. Harini.
Yeah, thanks for the introduction.
I gave you an extra degree, so I hope you're okay with that.
Thank you for that. Okay, so today I'm going to be talking about the symptoms of COVID. I know you might have heard a lot about it, but we keep getting patients and attenders ask the same doubts again and again. So I thought I'll just clarify about that. We'll just be talking about the symptoms and also on how to go about getting yourself tested in case you develop these symptoms. When are you actually a COVID suspect? When do you have to test yourself and how do you go about it? And in case it is positive, what do you do? In case it is negative, but still you have symptoms, what do you do? And in case you're a candidate for home isolation, How do you go about it? And this is what I'm going to be talking about today. So before moving on to the symptoms, I want to talk about two terminologies which you might have heard repeatedly. One is the incubation period of the virus. So the incubation period is nothing but the time gap between the exposure to the virus and the appearance of symptoms. So this can range between 2 to 14 days. On an average, it is about 5 days. And the infectivity period is different, as in infectivity period is the time when you are capable of transmitting the infection to another person. So this would start 2 days prior to the onset of symptoms and can go on for up to 8 to 10 days after the onset of symptoms. And for an asymptomatic person who is probably capable of transmitting the infection, we do not know how to assess the period of infectivity yet, as in there is no concrete evidence for it as of yet. And those who are infective can be asymptomatic and can be symptomatic also. We do ascertain risk factors for patients. The elderly people, those who are above 60 years of age, diabetic, hypertensive. So these are the ones who have comorbidities, that is previous coexisting diseases from before, like diabetes or hypertension, chronic heart disease or liver disease, renal disease, cancer survivors, or post-transplant. So these are all people who are slightly immunocompromised, as in their immunity is on the lower side, so they are at risk for developing a more severe form of the disease. And coming to the COVID as such, the disease part. So the main organ which bears the brunt is the lungs. Initially, this was thought to be a purely respiratory virus. As in, initially, when the disease had just started, that was the idea. But now, as we learn more and more about the disease, we understand that it is capable of causing a multi-organ damage. So there were a lot of post-mortem studies done in China and Europe. So where they found out that the small blood vessels going to multiple other organs have what we call as the coagulation. That is, the small vessels tend to get clogged up. Okay, and this is also part of the COVID disease. And even this even includes the blood vessels going to the lungs, which can get clogged up, and it will again like decrease the oxygen transfer to the lungs and again contribute to the pathogenesis of the disease. Coming to the symptoms as such, here the common symptoms which we see are fever, cough, sore throat, nasal congestion. Sometimes it can just be a transient thing. They may have a mild sore throat and then they'll be fine for a week. After a week, they may suddenly develop breathlessness. So breathlessness, and somewhat symptoms which are a little more specific to this are the loss of taste and loss of smell, or a decrease in perception of taste and smell. So I wouldn't say it is completely specific to COVID. This has been documented in a few other viral infections as well. But during this pandemic situation, if somebody has a loss of taste or a loss of smell, then definitely we have to rule out COVID. They can also present with breathlessness, chest discomfort, chest tightness. Elderly may come with atypical symptoms. They may not have fever, but they may suddenly come with confusion, disorientation. Then severe body pain is one of the very common symptoms, fatigue. Some people even develop a rash. And another rare but a little slightly specific symptom to the COVID is the reddish purplish nodules they develop in the toes. It's a kind of rash which is rarely seen in COVID. And some atypical presentations also are there, like stroke or heart attack, like what we call as myocardial infarction. And this happens due to the same reason that I already mentioned. That is, the arteries tend to get clogged up in COVID. So that is what leads to these complications as well. So when do you suspect that a person has COVID, and whom do we test? So if a person has fever and any of the above symptoms that I mentioned, and particularly if the person is a resident of a containment zone, or if the person has had a slightly more specific symptom like an anosmia or a loss of taste, or if the person has had a definite contact with a person who is COVID positive, then they're all candidates to be tested. And also any healthcare worker who develops any symptom needs to be tested. Any contact, that is, if you have a COVID positive person in your house, they are isolating themselves in a separate room, but still, if you develop a symptom, you have to test yourself. And we test all our inpatients, whoever is getting admitted in any hospital now, just to prevent cross infection and to admit them in the right side, as in the COVID wing or the non-COVID side. And also any stroke or a heart attack in young people particularly, we do test them for COVID. And if there is an unexplained fever for 3 days, then definitely we must test them. So how do you go about it? If you think that you need to get tested, what do you do? Either you can call the government helpline and they will guide you where to go. There are fever clinics all over Chennai now. So they will tell you what to do. Or if you want to go to a private center, you can call up the nearest hospital. Almost every hospital has a fever clinic now. You can call up and tell them that these are your symptoms. So they will tell you to come, or they will give you a prescription. With that, you can get it tested, even by home collection method. And so suppose if you are asymptomatic, but if you have had a contact with a COVID positive person, when do you get tested? Suppose, let's say, I met somebody yesterday. Today, they're calling me and telling me that they have turned out as COVID positive. So there's no point in me panicking and immediately going and getting myself tested on the same day. So the best time for an asymptomatic contact to get tested is from between day 5 and day 7 of exposure to the positive person. So that would be the ideal time to get tested. Meanwhile, it is advised for you to quarantine yourself. Suppose if you have typical symptoms, if someone has fever, breathlessness, but the COVID test turns out to be negative, what is the way forward? So this is something that we face very, very commonly, patients with very typical symptoms, but turning out to be, so what we commonly do is the RT-PCR test. That is this PCR, we do a swab and we run an RT-PCR test, which will actually detect what we call as the genetic signature of the virus. There is a 30% chance that you may have the disease, but you may have the infection, but still the test does not pick it up. So we should always have this in mind. So if you have symptoms and if you are going to be negative for as per the test, you still are advised to continue your quarantine period. And if it is a strong suspect, we can repeat the swab after 48 hours. And if the patient develops symptoms like breathlessness, we do a CT test to see if there are findings which are typical of COVID. And if the findings are typical of COVID, we do admit them in the COVID ward. So this is how we go about it. So now if you test positive, what is the way forward? Definitely, please go to the nearest fever clinic after calling them up. And we usually classify patients as mild, moderate, and severe category. So mild category would be someone whose vitals are normal. So when we say vitals, we normally look at the, of course, temperature is one thing, and pulse BP, the respiratory rate, that is the number of breaths you take per minute. And also we look at the oxygen saturation by finger pulse oximetry. So if your oxygen saturation is more than 95, you have no signs of pneumonia. If you only have a low grade fever with an occasional cough or a sore throat and just loss of smell, so these are all mild symptoms, then you come under the mild category. And if you are less than 60 years of age and do not have any other coexisting disease, you are a candidate for home isolation after being certified by a medical practitioner. So the medical practitioner, if he or she is satisfied that you are a candidate for home isolation, the next questions that we ask you is, do you have a facility in your house to isolate yourself? That is a separate room with an attached bathroom. You cannot share, preferably not a shared bathroom. And so that is very important. And also you should have a separate set of utensils for yourself. And also if I mean, the only time you would be, as in you can keep your plate outside and they can just put food in, and every time you open the door for such things, you have to wear a mask so that you don't expose the other people in your house. Okay, and it's advised that you have a pulse oximeter at home and keep monitoring your oxygen saturation. If it is consistently above 95, there is no issue. If it goes below 95, then if it is consistently below 95, then yes, it is an indication to go and get yourself admitted. Also, if your symptoms are worsening, if you're having persistent cough, or if you develop breathlessness, or if you're having high-grade fever which is persisting, or if you develop chest pain or chest tightness, these are all indications that you need to go and get yourself admitted. Suppose if you have only mild symptoms, but you are above the age of 60, or if you have any other coexisting disease, then we usually advise hospital admission because you have risk factors to have a severe disease. Just to keep you under supervision, we would prefer you to get admitted or at least be in a care center. Moderate disease is when the oxygen saturation is between 90 and 94. That is definitely an indication to get admitted. If it is a severe disease, the oxygen saturation would be less than 90 and the respiratory rate, that is the number of breaths per minute, would be more than 30 per minute. So in that case, we would admit directly in a high dependency unit or an intensive care unit. And of course, I'm not getting into the treatment aspect. One more thing that I want to talk about is what is the way forward? I mean, this is one question that we keep getting, two questions actually. One is, our patients, when they get discharged, they keep asking, is there a chance that we would get this COVID again? If I have to give a very honest answer, I don't know. We don't know because we don't know about this virus yet. All we know is, yes, you are going to have antibodies which are going to last for a few months, but how long is it going to last? We do not know. And how much of an antibody response you need to have for it to fight a reinfection, we do not know. But as of yet, there are only 1 or 2 documented reinfections. Even those are not, we are not very sure about it because they are not peer reviewed or anything like that. So, so we still need to wait and watch to know about the reinfections. And what is the way forward? When is all this going to end? We don't know. It might take a year, it might take 2 years. So these are the possibilities. One is about 60% of the population should get immune to it naturally or in pockets if vaccination is available. And also, very, very, very important is to wear your mask and practice social distancing, because by doing that, we are going to cut down the R factor. The R factor is nothing but the reproduction factor. That is, how many people is one infected person going to give the disease to? So this is going to come down if we practice universal masking and social distancing, which is very, very, very important for us to bring down the pandemic. So stay safe, stay home whenever possible. Go out only if essential. Thank you.
Thank you, Dr. Harini. Fantastic. I think you sort of summed up whatever most people have done over 4 months, I think. Very good. So I'm seeing a couple of very interesting questions coming in. So please type away. We'll make notes of these and then we'll pose it to the panel in a little bit from now towards the end. Now, next up, we have Dr. Krithika Muthusamy, MS OBG, DNB OBG. So apart from teaching us all the alphabet once again, she's also a young obstetrician and gynecologist practicing in Adyar. She's completed an MBBS from Madras Medical College and MS OBG from SRM College. She's also been an assistant professor in Kasturba Gandhi Hospital affiliated with MMC for 2 years. She's currently also running her own clinic where she provides complete OBGYN care. Over to you, Krithika. Krithika, you want to unmute yourself? Yeah, that's better.
Can you hear me now?
Yeah.
Yes.
Next up, I think probably a degree in IT might be nice.
Yeah. Thank you. Thank you for that. Okay. So I was saying good evening and thank you for the introduction. And today I'm just going to quickly talk about a few FAQs on COVID and pregnancy. So I just have a set of common questions that people generally ask, and I'm just going to answer away. So number one, the most common thing that people ask is, can I get pregnant during COVID? I mean, is pandemic the right time to get pregnant? Should we plan pregnancy until the pandemic is over? Should we plan after? So the answer is yes, you can get pregnant Do not wait for the pandemic to get over. It doesn't seem like it's going to get over anytime soon. So don't make any don't postpone your major life decisions for the pandemic to get over. So if you really want to get pregnant, yes, you can get pregnant. Second, how susceptible am I if I get pregnant? So just because I'm pregnant, am I more susceptible to the infection? The answer is no, you're not. There is no, although pregnancy is an immunocompromised state, there is alteration of immune system in the body during pregnancy. Still, there has been no evidence that suggests that in pregnancy, you are more susceptible to COVID infection. So what I'm trying to say is the risk of you getting COVID during pregnancy is similar to the risk of a non-pregnant patient getting COVID. So you are not susceptible. That is the takeaway point. Now, if you are pregnant already, or if you get pregnant, what are the additional precautions you have to take? Now, all the basic precautions, the other speakers have already enlisted, all the mask wearing, hand washing, and all those things. So in addition to all that, what are the things that you're supposed to do? Number one, your antenatal visits. A lot of people ask us, is it safe to come to the hospital? I mean, hospital is a high risk zone. So how do we come there, and et cetera, et cetera. Unfortunately or fortunately, there is no other way. Pregnancy is a very time bound condition. There are certain things that you have to do at that particular point of time, and you have to do it only in the hospital, like doing a scan. You have to do it only in the hospital, or taking like a blood test. So you have to, there is no other go. You have to go to the hospital. The thing that you can do is you can plan your appointments. You can talk to your OB-GYN, and you can make sure that you don't have long waiting hours in your clinic or whatever. And you can plan your appointments that way. Number two, as far as diet, exercise, and all those things are concerned, interestingly, what we are seeing during this lockdown period is a lot of pregnant mothers are at home. They're being pampered and fed, and they're not stepping out to walk or exercise. So we're seeing a lot of patients coming up with obesity, coming up with gestational diabetes mellitus, and things like that. Okay. So what I want to insist is, it is, yes, you cannot step out for exercise and all, but you can, when you're at home, do something to burn your calories and keep a watch on your diet. And you can take rest. I mean, but people take too much rest. So you can avoid that, and you can, balance all these things out. And another important thing is people start taking all these vitamin C and zinc and Kabasura Kurimir and this and that, because, there is this presumption that those things prevent COVID. So factually speaking, none of this has been proven to prevent COVID, number one. And number two, too much of all of this can result in toxicity. So please do not take unnecessary medications. Always talk to your OB-GYN before you take anything in the name of prevention of COVID. Third thing that I wanted to talk to you is what are the things that you should anticipate in pregnancy as far as COVID is concerned. As in, what is the impact of COVID in pregnancy? A lot of people come and ask us, will it affect my pregnancy course if I become positive? Will it affect my baby if I become positive? So the thing is, no, it does not. We don't have any evidence that it affects your pregnancy course, it alters your pregnancy course, or it affects your baby or anything. But that is mostly only in mild or moderate illness. In severe cases, yes, your pregnancy may be altered, or it may impact your baby, but that is not because of the virus directly. The virus will sort of debilitate your general health condition, because of which you may go in for complications. But the COVID disease per se does not alter your pregnancy course. So you do not have to worry if you turn positive, if you're having mild or moderate infection. Now, what are the other things that you have to keep in mind? See, you should understand that we are in a community spread, and you should not be surprised if you are turning positive, even if you're sitting at home. So please be mentally prepared to be positive, and have a plan. I mean, I tell everybody that always have a plan. So if you're positive, find out where you have to go, which hospitals do take up OB-GYN care for COVID patients. So find out which hospitals do that and plan your delivery. Find out, if also, COVID is not an indication for C-section. You can very well have vaginal delivery, but if you are COVID positive during your third trimester or something, talk to your OB-GYN about your mode of delivery, talk to them about where to get delivered and other things. Okay, so be mentally prepared for all these scenarios is what I'm trying to say. And another thing, traveling. So generally women have this thing, they go to their mother's place for delivery and all that. So now because of the lockdown, they're not able to go, and they try to go to tier 2, tier 3 cities and all those things. So what I tell my patients is, please stay wherever you are. It is not important to travel now because number one, we don't know exactly the status of COVID illness there. Their numbers may seem very less, but that's also because the testing rates are very less. And number three, the healthcare is not as equipped to handle a positive case there as much as it is in a tier 1 city. So stay put, don't expose yourself unnecessarily to infections, and avoid traveling. And after delivery, this is another common thing. Can I breastfeed my baby? If I'm positive, can I breastfeed my baby? Can I keep my baby next to me? And all those questions arise. So I just want to address that. Yes, breastfeeding is not contraindicated in COVID. The benefits of breastfeeding is always more than the risks. So if you're COVID positive, you can very well feed your baby. Of course, you have to wear masks, you have to wear gloves and all those things, but you can always breastfeed your baby. So these are the common questions that I usually come across, and I think I've answered them. There's one more thing that I want to talk about, which is mental health of the pregnant mothers. Now, pregnancy is a very stressful condition per se, physically and mentally, even for normal people. But now in the middle of the pandemic, pregnant mothers are having a lot of doubts. They're very anxious. They're depressed. There are a lot of problems going on, and it is really, really taking a toll on their mental health. So if you have somebody in your house who's pregnant, or if you know someone who's pregnant, please, the support is really, really important. The moral support is really, really important. So talk to them about it. Give them all support that you can. And if you are pregnant yourself, please reach out to whoever you want if you need anything. And it's very important for you to stay physically and mentally healthy. I think that's about it. Thank you.
Thanks, Krithika. Wonderful. I think it's almost as if I sent you a bunch of questions and you decided to answer them through your speech.
Yeah.
Very well. Thanks. And it's a very important part on mental health, right? Like, especially, of course, being pregnant is stressful as it is, and then you've got this to contend with as well. So very well said. Thank you. I'm sure you'll be getting some more questions towards the end. So now moving on to our very own president, Dr. Avinash. In the midst of all the broken bones, coronavirus, etc., he's agreed to take on the president's role at NextGen, and it's doing a fantastic job given the circumstances. Of course, he's supported by a brilliant board behind him, which includes his own wife, our Bihari, that puts most Tamilians to shame with her grasp of our language. Over to you, Doctor.
Thank you so much, Vivek. That was such a nice, such an enthralling and such a nice introduction for me. And I really don't think anyone has introduced me like that before. And also thanks for your introduction for Shivi as well. So while I was calling all the presidents, inviting them for this meeting, and first of all, thanks everyone for attending. And my presidents, it's really an overwhelming response. Thank you for taking time off a weekend where you could be spending it with your family to hear, get yourself educated. So really kudos to you. I also thought I take this opportunity to explain a few details about our club and what we do and what we have been doing over the past few years. And also a lot of the presidents who I called were, always had a double take. Next gen, like, what is that? And so I just thought, okay, let me introduce the club to the district as well. So we at Rotary Club of Madras Next Gen, we've been here for 8 years. We are a young club, young as in been here for 8 years, as well as young members, averaging between 25 and 38 years. And being young, we've always focused on, doing better for the younger part of society, that is for the children of the society. So coming to our projects, the first one that we have taken up this year is our technology donation drive, where we have started collecting laptops, which have used laptops, which people don't have any use for now. And we have been donating that to people in need. So currently we have got 55 laptops from our corporate sponsor, that is Standard Chartered Bank, 500 headphones from Suntronics. And apart from that, our own members have donated close to 12 to 15 laptops, not 10, sorry. And there you can see a photo of me donating to someone in need. And so to all the presidents and club members, other club members here, if you have any laptop that you would like to donate, we would be happy to take it from your hands. And also, if you know someone who is in need of a laptop, some really deserving person, we'd be happy to donate it for them. And you know who I am, you can reach out to me, and we would help you get in touch. Second project for this year has been our virtual classroom. So one, we have tied up with the UNI and the government school of Manjikole and Shanainagar have getting weekend classes from UNI India. Also, we have an online activity room, which every Wednesday we are taking storytelling, arts and classes, dance, meditation, yoga, and also spoken English classes for the government schools in Chennai. Particularly 3 government schools, one in Shanainagar, 2 schools in Shanainagar, and 1 in Kottuppuram. And also we are having mental health workshops for these government schools as well, with topics ranging from motivation, child abuse, and also career counseling. These are some of the pictures from all our Zoom classes for the children, some of the art classes, and also some of the spoken English classes and mental health classes. And now coming to our flagship project for this year, we have taken up a village, Tekur, in rural Tamil Nadu. And I'd implore you to watch this video for a few minutes.
Did you know 2 out of 3 Indians live in villages? Due to the ongoing health and economic crisis, rural India risks being set back decades in terms of food security, income, education, and gender equality. This is how you can help protect our village. 50% of rural India does not have enough food to eat. Malnutrition is the single biggest killer of young children and pregnant women in India, causing around 680,000 deaths every year. This can be prevented by implementing our nutrition scheme, where young children and pregnant mothers get nourishing meals delivered to their homes. 33% of rural parents said their child may drop out of school due to this financial crisis. Many will turn to child labor to make ends meet. We will distribute second-hand digital devices to underprivileged students and train the village teachers in e-learning to ensure children remain engaged in school. The Tamil Nadu unemployment rate as of June 2020 is 13.5%. Many have returned to villages without jobs, and this has caused an increase in alcoholism and domestic abuse. We will create a network of unemployed men and women in the village and connect them to regional companies for employment opportunities. India spends the lowest percentage of GDP on public healthcare in the world. 67% of Indian healthcare costs are paid by the citizens themselves. We will provide oxygen supply and low-cost ventilators in the locality to help combat the pandemic. This is how you can help Project Protect Our Village deliver 4 pillars of development: nutrition, education, employment, and health. Donate now to protect our village.
And this shows we have also started distributing rations to the village. This is close. These are rations for nearly 300 families of the village for 1 month, and it is being distributed right now, as you can see. And if you need further information about this project, it is there on our Instagram page, #ProtectOurVillage. Also, this is a project we started last year, and it has been the face of our club. That is the Build a Library project, where we have been transforming existing classrooms in a number of schools into beautiful learning libraries. So as you can see, these are some of the pictures. And in the making of these libraries, we are also providing employment to a foundation called Aravani, which uses transgenders for doing the painting, and hence we are providing employment to them also. Apart from that, for COVID, we've been donating a lot of PPE kits, face shields for the fire people, the foot-operated sanitizer dispensers, and the latest in our COVID for COVID awareness is our COVID awareness campaign. So I'd like to request you all, if you are interested in partnering with our club in any of these projects, please do reach out to us. If you have a laptop you can donate, please do donate it to us, and we will find someone who needs it. Or if you have someone who needs a laptop, please do reach out to us. We will help them get a laptop. And finally, if any of these projects do appeal to you, please use a Razorpay link below to donate as you can. Thank you so much, my dear presidents and my dear friends, for being a part of this project. And now we shall go to the questions that have been waiting for us. Thank you.
Thank you, Doc. Thank you very much. And I think we will open up the floor to questions. I've already got a few of them on the chat box, and also some that have sent it to me privately. I think we will start with something a little more forward-looking, right? So we'll start with Dr. Pavi on the vaccine. Of course, obviously nobody has a magic wand and on when is it going to be available, but by law of averages, when you've got over 165 vaccines on trials, one of them is bound to succeed. But many people have the question on virus mutates by nature, right? So assume that we do have a strain that we've got a vaccine for. What are the probabilities that we are going to see mutation, in which case those antibodies that your body generates is no longer going to be effective against a mutated strain?
Excellent question, Vivek. We get this often.
That was actually my own question, Doctor. So thank you.
Okay. Excellent question, person. Okay. So the people have this image that a mutation is something that will make a human into a humanoid and some weird creature will come up. Actually, most mutations are silent. Silent meaning, yes, there will be a change in the viral genome, but it may actually not have any impact on the virus structure or function. And coronaviruses generally don't mutate as rapidly as influenza does. When people think of, oh, virus strain mutation, they actually have heard lots of stories about influenza, which actually mutates very fast. Coronavirus is not like that. It's a relatively stable virus. And as of recently, based on epidemiological studies, the little mutations that are found in the virus still doesn't affect the vaccines that are being developed. So we still can hope quite positively that the vaccine that is being developed right now will be effective, even if the virus goes through some minor mutations.
Got it. Thanks. That's positive. That's positive. That's good to hear. Dr. Harini, I will give you, I'll pose this to you. So
yeah,
talk about herd immunity, right? I think the world has seen multiple discussions on this. We've also had a couple of countries that tried to adopt the system. I think Sweden being one of the more noteworthy ones.
yes.
What is your take on herd immunity? Because obviously, in a country as large as India, for us to achieve herd immunity, the flip side of it will be that there will be a lot of deaths as well, right? So do you think this is an achievable target?
Eventually, any pandemic will die out only after after majority of the population becomes immune to it, not majority. In some cases, like in COVID, the estimate number is 60%. So they say that when the 60% of population is immune to it, we expect the pandemic to settle down. So even in history, we've had a lot of pandemics. Invariably, immunity has to come either naturally after getting the infection or by vaccines. So, but Sweden initially thought it's a good idea to just expose people to the infection so that they can have an earlier, but their mortality rates went very high, and they also announced that it was a failed strategy. So we cannot really advise people to go and expose themselves to the infection, as in we just have to allow the natural immunity to take over or wait for the vaccine.
Got it. Thank you.
Yeah, because for a population like ours, we cannot afford to expose majority of the population to the infection, where we will not even have enough beds to accommodate. Even if 1% of people are going to die, that's going to be a lot in our country.
I mean, of course, that is always the case with India, right? Even if you're one in a million, there's about 1,300 people just like
exactly.
So,
yeah.
I think there was one pretty basic common question, but still very, very relevant today, on what type of masks need to be used. Anyone want to take that?
Harini, you want to take that?
Yeah, sure. Yeah, so actually the N95 masks, which are the most efficient for this, are recommended for healthcare workers or those who are going to be exposed, as in but for the general public, a normal surgical mask or a cloth mask would do, because it's more important that you also maintain social distancing apart from just wearing the mask.
Got it. Thank you. Okay, next I would like to, sorry, I was muted. Okay, that was probably one of the few times that I was muted in my life. Okay, so I'd like one question at Dr. Krithika. So this is very interesting. Actually, I had this in my mind as well. So are infants or very young children immune to COVID? Okay, there's nobody immune to COVID, right? Other than someone that's already had it and recovered from it. But are they less susceptible to be affected by anything major from COVID? And if yes, what are the likely reasons for that?
So I think I've unmuted. Okay. So no, infants are not immune. We do have cases of newborns being infected. But the interesting thing is the newborns are not infected because of the mother. What we call the vertical transmission, which is nothing but the transmission from the mother to the fetus, that doesn't happen in COVID. So the infants, after they're born, they probably get it by airborne or fomite infection, but it is not because of the mother, number one. And number two, about the disease progression, course of the disease in infants or newborns, what the studies say is, yes, they are affected less than the adults, because as Pavithra was talking about those AC receptors, they say that those receptors to which the virus goes and latches on is much less in the infants. I mean, it's not developed as much in the newborn, infants, and even in the pediatric age group. And because of that, the virus does not, affect them in its full swing. But they will get infected, but it may not be as severe as it is for adults.
Right. Thanks, Krithika. Of course, as you always say, there's always a silver lining to any cloud, right? But of course, the flip side of it is when children don't have any symptoms at all, they go and hug their grandparents, right? So,
yeah.
All right. So
exactly.
there's another question that I found interesting on the chat box itself. I'll throw this to Dr. Bhavi. So we've got one question that was: do some races or people in some geographies have better immunity? Of course, I can understand that someone living in squalid conditions already probably has better immunity than someone living in Sweden, right? But at the same time, have you seen any data that sort of points to the fact that some percentage of population in some country better equipped against the virus itself?
COVID-19 is a new and novel virus. It has never been in existence before. There is absolutely no one in the world that had any sort of pre-existing immunity towards this virus. There are very, very, very niche cases of some small populations having some resistance to some viruses. But for COVID, there is no known study that says any population is more resistant or less resistant. We're all equally susceptible or equally resistant to the virus.
Understand. Okay. One more that I saw was, I'll get Dr. Harini into this. Quite a simple question, but again, very pertinent today, which is, what are the differences between a common cold versus COVID symptoms, please? I'm sure you've never heard this before, by the way.
No, it's actually not so simple because it's very confusing. The symptoms are very similar many a times. If you compare COVID and the influenza, many symptoms tend to overlap. There are a few differences, only that the incubation period is much longer in COVID, and also comparatively, compared to a common cold or an influenza, there is lesser incidence of upper respiratory symptoms. That is, COVID has more of fever, so cough and dyspnea, breathlessness, and less of nasal congestion, whereas that would be the predominant symptom in common cold. And in common cold, fever is not so common, and a particularly high-grade fever, you're more likely to have low-grade fever. But again, all these symptoms overlap because we see COVID patients having only upper respiratory symptoms. We do see COVID patients having only low-grade fever. So it becomes really difficult to distinguish at times. Yeah, so it would be left to the discretion of the medical examiner who's looking at the patient.
Okay, got it. So we've got one more question coming in. That's at Dr. Krithika, obviously. So when a lady is pregnant in the house and the husband tests positive, apart from isolation, is there anything else, any other extra precautions that needs to be taken in terms of medicines? I think we can all safely say that, there isn't any medicine today, but we're waiting for the vaccine. But on other than isolation, anything that she needs to be extra precautions about?
No, there's nothing extra that you need to do. Actually, it's not even called isolation, it's called quarantine. There's a lot of difference between quarantine and isolation. So if your husband or anybody at home tests positive, first of all, they will be isolated. They'll be isolated or be in a separate room. Apart from that, it is important that you be quarantined because you have been exposed to that person for that significant period of time. So we advise the pregnant mothers to quarantine themselves for 14 days. And it is not necessary for them to get tested unless they develop symptoms. If they don't have symptoms, 14 days they have to be quarantined, and after that they can be normal. And in those 14 days, if they have their appointments or scan or any schedules that whatever they were supposed to do, that can be postponed to 14 days later.
Okay, understood. Okay. Got it. So there's one, again, there's a bunch of questions coming in, and these are all very good questions. Please keep them coming. One is, since there is no proof that Kabasura or even hydroxychloroquine sulfate for that matter has any sort of an effect or any sort of significant effect in reducing the symptoms of COVID, why are the government still promoting it? Anyone wants to take a shot at that? We'll keep it apolitical, please, as much as possible over here.
Kabasura is being given only by Tamil Nadu government. So I think it is more of something like, it is not harmful. So it's okay to give it kind of a thing. See, basically, we are allopathic doctors. So and we work on evidence-based medicine. So we don't have an evidence for Kabasura. So we do not, naturally, we usually don't recommend things which are not evidence-based. So, but the native medication doctors do prescribe it. And I think the government has considered this because it is probably not very harmful. That's all I can say about it. And coming to hydroxychloroquine, initially initially it was thought that the areas where malaria is prevalent, they are having a lesser incidence and lesser severity of the COVID disease. That is why they came up with this idea that probably hydroxychloroquine, and also it's an immunomodulator. So, but now a lot of studies which have been done across the world are showing that it is not very useful as a prophylactic agent or for treatment purposes. But ICMR still has not withdrawn hydroxychloroquine from its treatment protocol. They are doing some study on it. They are probably waiting to complete the study and then change the recommendations according to the study.
Right, Harini, thanks. I think each country has its own way of...
Absolutely, yeah.
Most of Latin America, they're using ivermectin, which is an antiparasite, right? And
yeah. Here also in a lot of centers, they are using ivermectin. But again, it's not recommended by the ICMR.
Yeah, okay, cool. Okay, so next, I think we've got a very interesting question on tests, right? So I think the right person for this is obviously Bhavi. You've got the antibody tests, you've got the antigen testing kits, we've got the RT-PCR and all that. Your views on that, and also I think if you can throw a little bit of information on at what stage do you need to be taking a RT-PCR test or an antigen test, or how would you go about that?
Okay, the second part of your question about what stage you need to be taking the test, I think Harini covered that in her talk, depending on the person's symptoms, their exposure risks and things like that. Now, at this point, the only confirmatory test is your real-time PCR, and it's not the antibody test. The real-time PCR is a swab that is put in your nose and throat, and cells are collected to see if there is an active viral infection. This costs anywhere between 3,000 to 4,000 rupees. Now, the antibody test, it takes a blood sample either from your finger prick or from your vein to see if you have developed antibodies against COVID-19 infection. Now, this would be very simple if everybody develops the same level of antibodies, if all the testing kits had the same efficiency of detecting the antibody levels, and what stage after the infection you're getting this antibody testing done. Because like Dr. Harini said, the antibody levels are not constant and they tend to go down over time and much faster than other viral infections. For example, you would have had chickenpox once in your life and you'll never get it back again. But that doesn't seem to be the case for this virus. So an antibody test may be all right if you want to test a large population, like if you want to test an entire state, then you can test it to get some idea to see if there is some sort of herd immunity or not. But again, the question comes back to, can you really develop herd immunity if the antibodies don't survive in the body for so long? So, and the antibody test is something that can be a screening tool for whether someone had an infection or not, but you cannot conclude it as being absolutely yes, they have an infection right now versus they had an infection a few weeks back. So it doesn't mean anything in terms of whether you need to isolate, whether you need to get tested further, whether you need to be treated for anything or not. So in my recommendation, out of curiosity, sure, you can go ahead and get it, but it doesn't mean much in terms of diagnosis.
Got it. Thanks. Actually, you sort of hit upon a point over there, right? There are obviously some, fake media, if we want to call it, that talk about people getting it for the second time, and when they do get it for the second time, it is much milder. Is there any proven instance of people actually getting it for a second time? And if they are getting it for a second time, are the symptoms any different to what it was the first time?
There was one case, Vivek, that's been sort of published, but it's not a comprehensive study by any means. So before we can't conclude anything from that particular case. One single case is just a case study. It doesn't mean anything in terms of understanding more about this virus or reinfection.
Got it.
True. And also, if I can add, I think 1 in so many millions, I don't think we should be worried about it,
You're saying it's a test from China and probably was a fake, I mean, it's a
No, it's
No,
no, that's not what I'm
Don't
saying.
go there.
We'll keep it apolitical, Harini. Okay. Okay. I think I probably might not take the last question that came in. I think we've just about run out of time over here. Unless Doc wants to take that question, or I think we can wrap it up right now. It was a wonderful session, very, very, very informative. I think big kudos to all the participants. They've been absolutely wonderful. I'd like to invite Sneha to give the vote of thanks, please. And please do mention me when you talk about the vote of thanks.
Can you hear me, Vivek? I'm going to start now.
Thank you.
Yeah.
And as soon as you start with me, you're good to go.
So I would like to thank and propose my vote of thanks to our chief guest today, DG nominee Dr. Nanda Kumar, for gracing today's webinar. And apart from that, I would also like to thank our panel of experts, Dr. Krithika, Dr. Harini, Dr. Pavithra, for your time and making this webinar interesting and keeping us all COVID equipped in the coming days. I'm sure all our participants have taken your note, suggestions, and advice. Thank you so much. Lastly, I would also like to thank our participants today, RI District 3232, presidents and secretaries, and my fellow Rotarians. Thanks so much for being with us this evening. And I would also like to thank our past district governor, Raja Srinivasan, who's been our founder DG. And thanks for being here, sir. Thank you. Good night.
Over to you, Doctor. Any last words?
Thank you for everyone for taking your time and attending this seminar. I hope it's made a difference and you have more clarity on the subject. So thank you so much for being a part of this COVID awareness program. Yeah. So I now call the meeting to order. Thank you.